From Birth to 1 Year, Chapter 18, page 303. Hepatitis B can be given at the hospital to the newborn before they leave. Parents must keep well-child visits. Assess height, weight, head circumference. Infancy begins the first 30 days after birth. Early infancy is the first 6 months. Older infancy is the second 6 months. Newborns have trouble accommodating vision. You should face infant and hold close. Nutrition. First 6 months, breast is best. Formula is adequate and should be exclusively until 6 months old. Foods can be introduced one at a time to check for allergies. Iron-fortified cereals first, if they can safely swallow a bolus. Green veggies after cereals, then yellow, orange. Fruits next because they're sweet. Lean meats and egg yolk at about 10 months. Egg whites after 10 months. Yolk is better nutrients. No cow's milk until after 12 months old. It can cause inflammation of the GI tract. Too much cow's milk equals milk anemia. The baby gets too full before they have enough nutrients, and milk depletes iron. Whole milk until 2 years old, then they can have skim milk or whatever the family has. For sleeping, they require 22 to 23 hours of sleep per day for the first few weeks. Older infants, 16 hours more or less. If there's trouble sleeping at night, adjust their nap schedule. At 4 to 6 months old, they usually sleep through the night, though not every baby will. If they wake up and are hungry, feed them. Separation anxiety at 8 to 10 months old intensifies at 12 months. Back to sleep prevents SIDS. Keep blankets, toys, etc. out of crib to prevent suffocation. Infant will triple weight and double height from birth by 12 months old. Anthropometric measurements are weight, height, head circumference. Growth is hereditary. This will affect the height and weight. Nutrition and health affects this also. Infants will grow in spurts and lags. A preemie will be more lagged. They will have 6 to 8 teeth the first year. The first ones are the central incisors. Clean the teeth with a damp cloth, and they are at risk for cavities, especially if feeding while sleeping. Wean them from the bottle by 12 months for good dental health. Their metabolic rate is almost twice that of an adult, and they require more nutrition. Give positive reinforcement. The learning of the pincer grasp means they will start to put everything in their mouth. Gross motor. They will hold their head up while lying prone. They roll over at 5 to 6 months. They hold head steady at 6 months. Sit and lean forward by 7 months. Sit unsupported by 8 months. Get to sit up by themselves 9 months. Pull to stand by 9 months. Cruising by standing and holding things by 10 months. Stand alone by 12 months. Begin to walk between 9 to 12 months. Fine motor skills. Find their hands by 3 months and hands brought together by 3 months. Grasp a rattle by 4 months. Transfer objects hand to hand 6 months. Finger thumb grasp by 9 months. Hit items together like symbols 9 months. Drink from a cup by 9 months. Can nest items by 12 months. Build an object of 2 into a tower by 12 months. If there's no smile by 2 months, it's a concern for potential autism. Teething causes discomfort. They can also run a fever. Avoid television, smartphone, tablets until after 2 years old. Never leave a bottle in the crib while putting them to sleep. Never put juice in a bottle. It can cause dental caries. Use sunscreen after 6 months old, as too much chemicals are absorbed into the skin before that. Keep them in the shade. Cover them with a hat. In the car, the center back row rear facing is the safest. Never leave baby or a child alone in a car, even for a second. Well checkups and vaccination schedule. Consent must be signed. Parents can decide not to vaccinate or split up vaccines over several months instead of all at once. Infants can start getting the flu vaccine at 1 month old. This is the vaccine schedule. Babies in the hospital must have an ID bracelet on their person, not just in their room. Prevent infection, have safe handling and neck support, temperature control of the baby's body, suction kit and O2 set up and ready to go in baby's room. No matter what, it must be ready. Encourage parental involvement. Infants with tubing are at risk for strangulation. Infants must never sleep in a hospital bed. 2 nurses must verify dosage. Otitis media is the most common in bottle-fed infants who recline while feeding. Breastfed are less likely to have ear infections. Infants at high risk of drowning and poisoning. Burns. Water heater must be set no more than 120 Fahrenheit. SIDS is sudden infant death syndrome. Happens in infants less than 1 year old. There is no obvious cause. Prevent this by not smoking around the baby. Don't let them sleep on their belly. They're more at risk if they had a sibling die from this or already experience an ALTE, apparent life-threatening event. Dehydration is decreased urine, low BP, no tears, dry skin, sunken fontanelles. A colicky baby, healthy and well-fed, cries more than 3 hours per day, 3 days a week, for more than 3 weeks. It'll go away at about 6 months. If a mom is breastfeeding, they can try no dairy. FTT, failure to thrive. Height, weight are continually below the 5th percentile. Organic FTT, they can identify the cause. Non-organic FTT, there's no identifiable medical condition. Chapter 19, Health Promotion of the Toddler. A toddler's height at 24 months usually represents half the expected height of the child in adulthood. 2 distinct toddler characteristics are that their abdomen protrudes and they have bow-leggedness. Heart rate 70 to 110, respirations 20 to 30, BP 90 on 55 to 105 on 70. A toddler's milk consumption should be monitored because overload can deplete iron. Caloric requirement 70 to 90 calories per kilo per day. Protein requirement 1.2 grams per kilo per day. Offer small portions chopped into bite-sized pieces, 3 meals and 3 snacks per day. They should be included at the family table for dinners. Toddlers require 14 hours of sleep per day. Naps in the afternoon should be avoided. They may develop a desire for bedtime routine, and parents should be encouraged to follow one. Causality, cognitive development. The toddler becomes aware that there is a causal relationship between 2 events. For example, turning the light switch on makes the room bright. Spatial relationship. Toddlers are aware of different shapes and sizes. A good toy is nesting cups or Russian dolls. Learning through toys is a good way to challenge the toddler in both motor development and cognitive psychosocial development. Erikson's stage, autonomy versus shame and doubt. Parents will highly influence the toddler's mastery of autonomy. They will experience deep fears, say no more frequently, have tantrums, and show an increasing sense of individualism. Stranger anxiety. Starting at 9 months old, the child may protest when they're given to someone they don't know. There are 3 phases of separation anxiety: protest, despair, and detachment. Protest, the toddler protests by loud crying and physical aggression. Despair, the toddler becomes quiet, depressive, and no interest in eating. Detachment, the toddler slowly re-enters into interactions and play. Caregivers should never try to reason with, threaten, or make promises, hit, or give in to a toddler during a tantrum. Timeout is a mechanism of choice. They should be brief with a timer. Consistency is an essential component of positive discipline. Acknowledging good behavior is essential to success. Children with special needs and learning disabilities are at the greatest risk of child abuse. Assessment of child abuse includes noting the type, location, and severity of injury, documenting all observations, and noting anything that doesn't fit in the history told about the injury. Not reporting child abuse can lead to fines and imprisonment. Key indicators of autism spectrum disorder (ASD) is impaired nonverbal and verbal communications, as well as impaired or absent social interactions, usually present before 36 months. Assess for impaired social interactions, communications, repetitive patterns, and lack of interest in activities, and lack of smiling. Treatment includes special education and support for family. Iron deficiency anemia. Children are more at risk for iron deficiency anemia if they consume 24 to 32 ounces of milk or more. Consuming too much milk will fill up the child's stomach and they will not be able to consume other nutrient-rich foods. You can lower the amount of milk given, provide the child with more rich foods to eat, and in some cases the child may require an iron supplement. Severe cases will need a blood transfusion. Toddlers are dirty, always getting into everything. They don't know how to perform proper hand hygiene. Help your toddler with washing before and after eating, going to the bathroom, and playing outside. Teach them how to cover their mouth when they cough and sneeze. If your toddler is in diapers, they are more at risk of being infected with fecal parasites. Start potty training early. The sooner you get them out of diapers, the better. As a pediatric nurse, it's best to always practice universal precautions and routinely assess children for infectious diseases. Keep the floor clean. Items that are not safe for the toddler need to be picked up and out of reach. They put everything in their mouth. It's better to be safe than sorry. Water safety. Remember, it only takes 2 inches of water for your toddler to drown. Never leave your toddler unattended near any body of water. Keep safety covers on all plug-ins. Never leave your toddler alone with animals. They do not know how to be gentle with them. You need to start teaching your toddler early about do's and don'ts. Stay away from the road. Don't go around vehicles. Hold parents' hand in the parking lot. You can use a chest harness in a crowded or public space. It can be very handy to hold on to your toddler and keep them safe. Always use federally approved car seats for the toddlers. You can look up state laws and regulations if you're unsure. They need to be wearing at least SPF 30+ sunscreen when outside, even if just for 5 to 10 minutes. Keep all cleaning supplies and chemicals up and out of reach. Chapter 20. The preschool age. There are care plans and medical issues to look at, and they are available in the book. Preschool development. The period spans from the child's 3rd birthday until the 5th year. They learn to share toys and attention, take direction from adults other than just parents. The child is focused on creative play, fine motor, and socialization with peers. Finer movement and motor control becomes prominent. The physical growth slows. It's important to provide praise when a child attempts new accomplishments, regardless of their success. Normal vitals: heart rate 65 to 110, respirations 20 to 25, BP 95 on 60 to 110 on 75. Immunizations continue. Preschool age group is exposed to more. Visual acuity matures by 3rd birthday, 2040, by 4th birthday, 2030. Visual disturbances often present during this time, and hearing should be 100% intact. There are 4 immunizations: varicella, MMR, DTaP, and IPV. Preschool age should consume half the calories of an adult, about 1,200 to 1,600 per day, depending on the growth and activity level. They are picky eaters. Teach parents to ensure a well-balanced diet. 2 cups of low-fat or non-fat cow's milk of calcium-fortified plant-based milk per day. Intake of fat should not exceed 35% of daily total calories. 25% is the goal for most children. Encourage protein in the form of legumes, tofu, lean meat, fish, and low-sugar cereals. Nutritious snacks that are appealing to preschoolers include peanut butter on graham crackers, celery sticks with cream cheese, carrots dipped in ranch. Use meals as an opportunity for family to become close. Encourage parents to prioritize nutrition and physical activity. Preschool age children need 12 hours of uninterrupted sleep per night. During this stage, it's common for children to wake up and need reassurance. Enforce bedtime routines and do not allow TV before bed. They don't require an afternoon nap. Nightmares are scary dreams that may awaken the child, produce crying, and require reassurance and comfort. Night terrors cause children to demonstrate great fear, thrashing arms and legs, yelling, and possibly wandering. The cognitive development, page 353, magical thinking, using their imagination to explain something they don't understand. Intuitive thinking begins around age 4, the ability to identify cause and effect, predict responses and consequences of actions. Symbolic functioning, experience of play, assigning meaning to an object than its actual meaning. For example, a cardboard box is a car, a blanket is a cape. The concept of time, they understand today, tomorrow, later, but they struggle with past, present, and future. The goals to learn are the days of the week, months of the year, and the basics of the 4 seasons by their 5th birthday. Selective attention are periods of which the child demonstrates in not responding to voices of parents, normally when the child is interacting in an activity that has captured their full attention. Language development is around 2 years old. 50 words. 3 years old, 900 words. 4 years old, they can answer simple questions with simple answers. 5 years old, rhymes, complex and compound sentences, talks in future tense, states full name and address. They should be able to identify 0 to 10 before their 5th birthday. Their dominant hand is established by age 4. The child should be encouraged to participate in learning activities to divert psychosocial development crisis. For discipline, a child should have a consistent discipline experience. If a 4-year-old perceives that a family member or parent is asking too much of them, they may act rebellious, aggressive, or provoke frustrations. Enuresis. This is inappropriate voiding, urinary incontinence, peeing after the child has successfully been potty trained. It may be quite upsetting for the child and the parent. Play. Its ideal toy selection during preschool period includes toys that allow children to mimic adult activities and pretend. Play adult work roles such as kitchens, construction kits, medical and nursing kits. Preschoolers learn through play. If facing many medical procedures, a preschooler can participate in medical play to learn about the upcoming procedure and better understand. Medical play also helps preschoolers act out their fears and emotions, providing an avenue for releasing their feelings. The phallic phase. The child finding his or her sexual identity by exploring genitalia and masturbation. This is normal, healthy behavior. Do not pass judgment or show disappointment. You should set limits, teach privacy in a non-shaming way, and children in this phase may try and compete with the parent of the same sex to try and win over the parent of the opposite sex. Preschool age is a good time to play doctor and learn about the opposite sex within limits and boundaries. Sexual curiosity at this age is normal. Not all children between 3 to 5 years old are enrolled in preschool. Some families choose less structured environments. The readiness for preschool is based on a child's emotional maturity, attention span, and toilet training. On the first day of preschool, parents should try to remain calm, show excitement and confidence, as the child will feed off negativity and use that as a reference for school. Preschool children need at least one well-child assessment by a pediatric healthcare professional. Children of preschool age need developmentally appropriate education about medication. For example, this is for your sore throat. Parents should remain involved from the very start of the process of medication administration. Dental hygiene is important. Cavities can progress and pass on to the permanent teeth coming in. Thumb sucking is a hard habit to break because children use it as a soothing relaxer, or when they're in fear, it can affect tooth alignment. Make sure children are not present when parents are discussing specifics about their child's injuries, or they can become fearful. When the time comes to inform the child of their health condition, a child life specialist should be present. The preschool child fears bodily mutilation, death, and blood, and they may show signs of regression in response to these fears. Parents and caregivers should allow the preschooler to develop a sense of what Erickson calls initiative by allowing the child to try out new skills and develop roles. Teach preschool children to avoid germs by hand washing. Strep throat is associated with pain. You can use the Wong-Baker Faces pain scale to rate pain. Encoparesis is fecal incontinence or soiling. It's a medical diagnosis given to children 4 years or older who have previously achieved potty training and is now soiling his or her clothing during the day. The child with encoparesis does not have the sensation or feel the urge to defecate, and the stool is passed without his or her feeling of defecation. They don't feel it until after it has occurred. The risk factors for encoparesis are medications that cause constipation, such as cough syrup, anxiety, depression, ADHD, ASD. On page 366 in your book, there is a nursing care plan for the child with encoparesis. Chapter 21, The School-Age Child. They will shed their deciduous teeth, their baby teeth. The weight gain is 4 to 6.6 pounds per year. At the end of this stage, they will grow 1 to 2 foot in height and double in weight. There is less snacking. The prepubescent time is the time right before puberty. The second sex characteristics, as in body hair, breast, testicular, and penile growth, and body odor. It's a time of rapid growth of bones and muscles. They will have major image issues, positive and negative. Puberty is girls aged 10 to 12. First signs are breast buds, then pubic hair. Boys aged 9 to 14, the first signs are testicular growth, then a red-lined scrotum with pubic hair at the base of the penis. Precocious puberty. Puberty that begins before the age of 8 for girls. Breast development before the age of 7 in Caucasians, or age 6 in African Americans. Puberty that begins before the age of 9 for boys. Deepening voice, enlarged penis and testicles with pubic hair. The cause of this condition often cannot be found. School-age children on average need 1,500 calories for the first 20 kilos of weight, plus 25 additional calories for each additional kilogram over 20 kilos. They require an average of 10 to 12 hours of sleep per night. A lack of sleep can cause a tremendous decrease in the child's energy at school and may cause poor academic performance. A child needs time to unwind before they sleep. They need bedtime stories and baths. The ability to think more abstractly and concretely and make rational judgments. They have the academic work highly influence the child's thinking and development. A strong teacher will positively influence the child's cognitive development, social skills, manners, and self-esteem. According to Erickson, the school-age child must have already mastered the development stages of trust, initiative, and autonomy to be ready for the next stage of industry, the child's sense of worth. Sigmund Freud's theory is that psychosexual development stages identify the school-age period as one of sexual latency, a time where sexual desires are lessened. Sexual drives are dormant or hidden, latent, while the school-age child focuses attention on schoolwork, hobbies, friends, and expanding the socialization and independence. The child progresses from free play that may be elaborately structured with rules and is able to interrelate with peers according to the rules. The child progresses from informal social structures during play to the demands of formal teamwork such as baseball, basketball, and soccer. The child learns how to participate in social structures within the classroom, including group projects of oral or written reports. Kohlberg's theory says that moral development is the school-age child sees rules and behavioral standards as coming from the expectations of those around them. As children grow and develop, the perception of rules begins to come from within as they interpret actions as either right or wrong. For school-age children, feelings of guilt may present if they have conducted themselves or made decisions they consider wrong. For spirituality, younger school-age children perceive God according to how he or she is taught by guardians. Older school-age children usually develop their own independent thoughts about his or her beliefs about God. This age typically enjoys family activities as they are fully aware of family member roles and responsibilities. Team play allows the child to have a sense of belonging and often allows them to find their first true friendship. It also enhances the development of morality as the child conforms to social norms, customs, and expected behaviors. Bullying. is aggressive behavior among children that is unwanted and demonstrates a feeling of perceived or real power imbalance. There is a table on page 378. You can see how you can identify and prevent bullying or cyberbullying of the school-age child. Safety and the hospitalized school-age child. You must observe for maladaptive responses such as anger, resentment, and hostility. Although children in this developmental period do not suffer the same intensity of separation anxiety as younger children do, being kept away from family is stressful and frightening and can lead to regression, aggression, and feelings of isolation. Observe for behaviors of isolation because of school absenteeism, lack of peer control, and increased dependence on caregivers. You can provide comfort, care, and control. Chapter 22, Health Promotion of the Adolescent. The adolescent is age 12 to 18, though some textbooks extend development until age 22. A time of rapid physical and emotional growth. Most children go through adolescence without serious complications. However, some do experience issues with violence, gang involvement, drugs, alcohol, unsafe sexual practices, eating disorders, and self-harm. Family and support or structure can assist with the adolescent in growing up well. As a nurse, forming a relationship with the adolescent is key to identifying problems and treatment, as most teens are reluctant to talk about issues. They require extra calories to support growth spurts, 1,500 to 3,000 per day for ages 11 to 14, 2,100 to 3,900 calories per day for 15 to 18. At least 1,300 milligrams of calcium per day is needed for skeletal growth, combined with at least 410 milligrams of magnesium, 600 units of vitamin D for optimal absorption. It's not advisable to consume fast food on a regular basis, as it's high in fats and salt with limited nutritional content. Girls experiencing menses will need to increase their daily intake of iron. Both sexes require additional protein and zinc. Obesity. 30% of all adolescents are overweight or obese due to increased screen time, and this puts them at risk of diabetes mellitus type 2, osteoarthritis, chronic kidney disease, and cancer. The abstract thinking of the teen mind. They will argue with the sake of arguing with adults. They will be self-centered in life and conversations. They are ready to jump to conclusions, and they constantly find fault in positions that adults take, parents, teachers, and other authority. They consider everything to be a big deal and overly dramatic with exaggerated responses. For adolescents struggling with gender dysphoria, the nurse or healthcare provider can provide information on possible options. One option to teens is a treatment that suppresses the release of gonadotropin-releasing hormone during early puberty. The development of secondary sex characteristics will be delayed until the child decides which sex they prefer to affirm. As a nurse, you must be familiar with current terminology for the LGBTQIA community and remember that terminology is constantly evolving. Teens face challenges concerning peer pressures, social expectations, sexual maturity, and their futures. Psychological maturity involves their developing sense of identity. Teens are in the phase of identity versus role confusion. They are examining and redefining self, family, peer group, and community while experimenting with different roles. If they are successful in this stage of development, they will develop confidence in their self-identity and optimism about their future. If unsuccessful, Erickson's theory suggests they will be unable to have a meaningful definition of self and therefore will develop role confusion. Sexual development begins at age 10 for girls. They will experience breast budding, increase in pelvic girth, and menstruation commences. It begins at age 11 for boys. With the enlargement of testes, their first ejaculation happens between age 12 and 14. The secondary sex characteristics of body hair and voice changes. On average, the African American girls experience sexual development 6 months younger than Caucasian girls, some as early as age 7. On the Tanner scale, a 5-point scale used to document growth of sexual characteristics, it shows if the child progresses on the scale too early or too late. An investigation must be made into their metabolic health to determine the cause. The Tanner scale evaluates hair growth, genitalia changes, and breast budding in girls. Early sexual maturity generally will indicate that the teen is more prone to sexual experiments and must be given straightforward and factual information about sex to protect themselves and others. Dental health, they need dental checkups, brush teeth at least twice a day, floss once. Hearing, be aware of damage from sustained loud music. Posture, you must differentiate between scoliosis and poor posture. Tanning and sun exposure. The use of sunscreen, they must be aware of tanning bed dangers. Social isolation. Identify when teens are demonstrating this, provide opportunities for them to interact in groups. Screening for health promotion. Child abuse and neglect, nutritional risks, substance use disorder, alcohol, drugs, tobacco use, relationship health and dating violence, STIs and pregnancy if sexually active, signs and symptoms of depression, suicide risk, and other mental health issues. Learning problems and the need for counseling, blood pressure and cholesterol, risk factors associated with cardiovascular disease or diabetes. Educate teens on the importance of safety equipment, for example during sports, and wearing seatbelts in vehicles. They can have counseling to avoid drug and alcohol abuse. Reinforce the permanence of tattoos and risks of injury from non-professionals using unclean practices and instruments, for example, self-piercings. Sex is a common practice and should be addressed with teens. Help them make health decisions about sexuality and relationships, preventing STIs and pregnancy. Use protection. Issues of gender identity and/or sexual orientation may become challenges during this stage. Teens may turn to a trusted nurse to ask questions, find community resources or support groups, and share emotions. Acne. This is considered normal and a common part of puberty, but it can cause distress. It's caused by hormonal changes, rarely caused by food. Hormones secreted during this time stimulate the sebaceous glands to become overactive, which trap dead skin cells and clogs pores, causing redness and swelling. Wash the face daily with lukewarm water and mild soap. Gentle cleansing is best. Over-the-counter topical products containing benzoyl peroxide and salicylic acid help prevent acne and reduce its presence. See a dermatologist for cystic acne. Over-the-counter products are not effective, or skin condition produces disfigurement. For depression, suicide, and self-harm, a period of adjustment and mood changes distinguish between normal teen emotional states versus development of depression. Emotional pain, suffering, and depression that may cause the teen to participate in self-harm, commonly cutting skin or tissue. And this is sometimes in places that you just don't even think about. So think about weird places like up of your legs and stuff like that. Emotional pain can cause depression and suffering. Self-harm allows them to focus on physical pain rather than emotional pain. It may release painful emotions such as anger, sorrow, or rage. This is a serious issue. The teen needs to talk to a mental health professional in person or a hotline to discuss their needs before it progresses to suicidal ideations. Assess the teen for evidence of self-harm, which are often hidden and can be on any skin surface, such as burns, cuts, scars, fresh wounds. And that is everything.